Hi there, it's Tammy here. And in this short video, I want to talk training considerations when it comes to exercise during pregnancy and why I believe you should be looking to specialists for your exercise selection or exercise prescription during pregnancy, as opposed to looking to social media influencers, athletes, and free generic online pregnancy workouts. Now, as a pregnancy and postnatal specialist strength coach with over a decade's experience working with the pregnant and postnatal population, part of the reason why I thought it was really important to make this video is because over the years working in a commercial gym, I have seen a lot, and I mean a lot, of pregnant women, not my clients obviously. They might have been clients after I spoke to them, but not at the time, because they're doing things that they either shouldn't be doing or could really be doing better. And the other side of this is the wonderful world of social media, where you see an assortment of exercises being performed by influencers with huge followings. And that includes coaches as well that aren't specialists in this area. And while I love seeing pregnant women exercise, the problem I see with this is these influencers, they maybe don't have the knowledge or expertise in this area, yet they're promoting their pregnancy exercise methodologies to their followers. And there are many times as a specialist that I've seen things happening in their bodies while they're performing these exercises that shouldn't be happening. And just as many that I look at being like, why are you doing that? You shouldn't be promoting this to your followers. And this can also include influencers who potentially have trainers themselves giving them programs, right? And of course, while it's always going to be better than going it alone, from my experience, there's certainly a huge difference between a pregnancy and postnatal specialist strength coach who's trained hundreds of pregnant and postnatal women over the years, has demonstrated experience and success in this area, and other types of coaches who might train a pregnant woman here or there, or be pregnant themselves, or, have done one course once just to get their certification. And sadly, this also applies to athletes as well, because it's kind of my belief that athletes fall into their own unique category when it comes to exercise during pregnancy, because, their bodies are their profession. They are supported by teams of specialists both before, during, and after their pregnancy. Probably that's just as important, if not more so, is being supported through their postpartum recovery journey. So something that can apply to them, exercises as athletes that they can perform are not likely going to be safe for the general population pregnant woman, or not all of them anyway. And while I absolutely love seeing the amazing things that pregnant athletes can do, part of the problem I see with this is general population women who don't have teams of specialists at their disposal, monitoring their everything that they do. They see athletes doing these things and think that it's okay for them to do as well, And a perfect example of this is someone recently sent me a video of an incredible CrossFit athlete who's currently pregnant, right? So she was on the rower and the ski erg. So this person sent this video to me asking whether this was safe. And while this athlete was on the rower, each time she went back into full extension, or kind of the end range of the pull on the rower, her abdominals were actually peaking, which is something that I would always try to avoid or minimize as much as possible during pregnancy, as to me, it indicates an inability to maintain neutral intra-abdominal pressure and places excessive pressure on the abdominals and the linea alba, which is the band of fascia that connects the abdominals. So this in turn can actually exacerbate abdominal separation. Again, something as a pregnancy and postnatal specialist, I try to minimize as much as possible during pregnancy. Now, of course, that is extremely brief description of something that's very complex and something that I go into much greater detail in the pregnancy process program. But for the sake of this video, this is the main reason why I typically avoid the rower during pregnancy, even during the postpartum period, and especially until the woman has greater control of the coordination between her breathing and the abdominal canister and her ability to maintain neutral intra-abdominal pressure throughout the movement. Now, the same thing was happening when this athlete was going into flexion on the ski erg, right? Again, the forward flexion of the abdominals on the ski erg is essentially the same movement as doing a crunch, which during pregnancy needs to be limited and controlled as much as possible if you are doing that movement, right? Again, the same thing during the postpartum journey applies, right? Now, the thing with athletes is, again, they have teams of specialists monitoring everything using advanced sports science tools. Again, this is important during their postpartum recovery journey because the reality is general population just don't have access to this. You know, the closest you'll get is working with a specialist in this area. You know, so to help you navigate the minefield that can be pregnancy exercise, in this video, I'll be talking about considerations that you might want to think about when training during pregnancy. I'll also be talking about things that I take into consideration or I take into account when designing principle-based individualized training programs for my clients. And before I start, I just want to clarify that although this list includes many things, it's by no means a complete list, as each pregnancy and person experiencing it is individual. But I really do hope that this video helps you navigate the minefield that is social media influencers. You know, generic one-size-fits-all swipe to train free pregnancy workouts and everything kind of in between. And of course, I'm going to start with some really important information on recommendations and considerations when training during pregnancy. So the first thing that we're going to start with is overexertion and strenuous aerobic exercise. Now, these are not recommended due to the diversion of blood flow to the mother's vital organs and limbs and away from the baby and placental unit. Now, obviously, this is going to be different for every person based on their level of fitness, but the 70% rule is always a good one to go by here, or maybe look at it as dialing it back 30% of your regular aerobic capacity. And when it comes to heavy weightlifting, please remember, again, this is relative to each individual. So what is considered heavy for one person could be light for the other. And this is all based on training age and experience. Now, the other consideration with this is exercise and strength progression that can actually be achieved during pregnancy, right? Because with correct programming, you can absolutely get stronger and have exercises progress during your pregnancy. So that something that was heavy for you when you first started training during pregnancy might actually feel light towards the end of your pregnancy. In my eyes, that's actually an ideal scenario, right? But overall, when it comes to lifting weights during pregnancy, for those who are already well trained, again, you want to kind of apply the 70% rule of thumb, right? So this applies to intensity, weight, range of motion, and many other training variables. So for example, if you used to do like 100 kilogram deadlift from the floor, I'd recommend decreasing the weight to at least 70 kilograms at a max, and you can then look to decrease the range of motion by maybe elevating the bar 30% or something like that. Again, there are many ways that you can manipulate training variables during pregnancy. That was just like one or two examples for one particular lift, right? Now, again, part of this has to do with blood flow and the diversion of blood away from the baby and the placenta towards the mother's vital organs and limbs, right? So that's probably one of the main reasons. And of course, the pelvic floor, right? And speaking of the pelvic floor, for all you runners out there, let's talk running. And I know this is a hot topic when it comes to pregnancy because, well, you know, Runners just love to run. So overall, long distance running is actually discouraged, for pretty much the same reasons, right? The diversion of blood flow. But the reality is, for a lot of pregnant women, running just actually feels uncomfortable, especially once you get out of that kind of first trimester. I mean, that's if you can even stomach running during your first trimester in the first place. Now, personally, I put running in the potential cost versus short-term benefit pile, and mostly because of the impact that it has on the joints and the pelvic floor. I mean, personally, I believe that you can elicit the same response using something like a cross trainer that's low impact on both the pelvic floor and your joints. Now, in my mind, if you're a runner, wouldn't you be better off making some modifications for a short period of time, like 6 to 9 months, right? Use a different modality that can elicit the same response for a shorter period of time to ensure a safer pregnancy and help you return to running sooner in your postpartum journey, as opposed to doing something like continuing to run and potentially causing some type of issue which hinders your return to doing something that you love a little bit further down the track. You almost want to think of it like playing long-term games, right? So in my mind, you always want to consider short-term benefit versus the potential long-term cost. Now, when it comes to lifting weights, right, and the pelvic floor, one thing that I believe that you absolutely need to continue lifting weights during pregnancy is to have an awareness of your pelvic floor and your transverse abdominis. Not only that, but an ability to correctly connect to these muscles in a coordinated way with your breathing while you're lifting weights. And this is extremely important for all females, but especially during pregnancy, because any load lifted where the intra-abdominal pressure is not contained correctly will be placing force through the weakest link, which can be out through your abdominal wall or down through your pelvic floor. Now, obviously, again, I talk about all of this in great length in the pregnancy process program. So I won't be covering it here in this short video. But we're going to keep going, because another position that gets contradicted a lot on social media is the supine position, right? Meaning on your back. Now, in my position, irrespective of what social media posts seem to say, it's my belief that this position needs to be avoided from around 12 to 16 weeks. Now, this is due to the enlarged uterus and the weight of the baby putting pressure on something called the inferior vena cava, which is a large vein that carries blood to the heart from the lower parts of the body, right? So the pressure on the inferior vena cava can compromise blood flow returning to the heart, meaning that it can potentially compromise the blood flow to the baby. Not ideal, right? Now, there is a train of thought that I've seen on socials, etc., that if you don't feel dizzy, it's okay. But I'm here to tell you, please don't listen to that. The important thing to remember with this especially is just because you can't feel it happening doesn't mean it's not happening internally, right? So please avoid lying in a supine position and exercising during pregnancy. Now, for all you yoga buffs out there, hot yoga or hot Pilates is also on the outs, right? And while you may think that this seems self-explanatory, I've certainly been in hot yoga classes alongside some very heavily pregnant women. Now, the research for this is around, again, the reduction in placental blood flow and the potential effects of dehydration from the heat. Now, again, this may seem self-explanatory, but during pregnancy, you also want to avoid contact sports, right? Or sports that put you at an increased risk of injury or a fall or something like that, right? Now, contact sports and sports that put you at risk of getting hit in the abdomen would be things like, hockey, ice hockey, boxing, soccer, rugby, rugby union, rugby league, basketball, lacrosse, right? Just to name a few. Now, sports that may have you falling or result in a fall would be things like water skiing, surfing, normal skiing, off-road cycling, gymnastics, and horseback riding. Now, the other things that you want to stay away from are things that might involve significant changes of pressure, things like scuba diving, right? Now, the reason that you shouldn't scuba dive is actually because the baby isn't protected from decompression sickness, and the baby's circulatory system can't actually filter out bubble formation in the mother's bloodstream. So that's why you can't scuba dive. And while we're here, things like skydiving during pregnancy are also out as well. Now, of course, all of those are basic guidelines to follow when you exercise during pregnancy, just basic things, right? Now, when programming for the pregnant population, there are certainly a number of other considerations that I always take, I always take these into account. And this is kind of where I see the fun, creative side of exercise selection and program design. You know, this is where I see that come into play, because the reality is, as a mentor of mine always said, there's more than one way to skin a cat. And what I mean by this is there's many different ways to elicit the same response from muscles that just don't place the pregnant woman in vulnerable positions. So why do it, you know? So what I'm going to do is talk through a few of those for you now, right? And hopefully they can help. And again, please note that some of these are recommendations, some of these are movements and exercises and equipment that over the years, working hands-on with the pregnant population and with pregnant women, hundreds of them, I've actually found that they struggle to maintain, regardless of their training experience, they do struggle to maintain neutral intra-abdominal pressure throughout the movement. Try saying that 10 times, I tell you. Now, I'm going to break these down into two different sections for you. We're going to talk about movement and equipment now. So we're going to start with movement, right? So we're going to start with movements that cause you to go into excessive flexion, extension, rotation, and lateral flexion of the side. Now, even though I just kind of demonstrated that, if you're not sure what I mean by this, flexion of the spine is when you crunch or bend forwards, right? Extension is when you extend backwards or bend backwards, right? Like a back bend. Rotation is a twisting movement, and lateral flexion is basically anything side bending. Now, I'm not going to go into every exercise that causes this because we would be here for hours and it's just not necessary, right? Because the most important thing to remember about this is these core movements all involve the abdominals and intra-abdominal pressure, right? And when done incorrectly, or when the movements are done past a certain range of motion, it's actually difficult to maintain neutral intra-abdominal pressure. And this then places excessive pressure on the abdominals. Now, over time, this can actually exacerbate abdominal separation, which again is something that you want to be minimizing as much as possible when it comes to training during pregnancy. And this also applies to any movements that cross your midline or rotational movements that kind of collapse the space of the womb, right? So you don't want to be doing any of that. And when it comes to something called the Valsalva maneuver, now this is basically a breath hold and then forceful pushing out of the breath with a closed mouth. Now, you might do something like that when you're trying to like clear your blocked ears or when you're like bearing down. Now, again, I'm going to talk about all of this, or I do talk about all of this in much greater detail in the pregnancy process program because it's kind of involved and I don't want to get into it too much in this video. But the main reason why you want to avoid this when training during pregnancy is it creates too much pressure on the pelvic floor, causing the pelvic floor to descend, right? And this is the opposite of what we want it to be doing. So the pelvic floor also comes into play when we consider wide stance positions, right? So things like sumo squats and sumo deadlifts, because again, this places increased pressure on the pelvic floor. Basically, the wider your stance, the more your pelvic floor is going to stretch in that position. And remember that your pelvic floor already has a fair amount of load placed on it on a daily, weekly, hourly basis, right? Because of the baby. So we want to be avoiding adding any unnecessary pressure to it, right? And if we're talking wide stance positions or wide positions, I also actually try to avoid wide lateral movements that open the pelvis too much. And that would be things like lateral lunge variations or the hip abductor machine in the gym, right? Now, the reason for this is it actually places excess pressure on the structure of the pelvis, right? Now, remembering that the pelvis is doing a lot of stretching and relaxing to allow for the growth of the baby and the birth. And it can actually become quite unstable, leading to pain being felt in this area. And this is especially through the pubic symphysis at the front and the SIJ joint at the back. And it's both of these areas that these movements place pressure on, or that wide lateral movement. Again, there are other ways of targeting those particular muscles that don't do that. Now, I know that I've spoken about the 70% rule already, and this definitely applies when talking about squats, right? Because so many people squats for pregnancy. Now, if you're someone who typically squats full range, or what some people might call ass to grass, then I would absolutely be avoiding this full range of motion during pregnancy, again, because it places added pressure on the pelvis and your pelvic floor. And there is a bit of a caveat that we can apply to this, and that's once you get to 36 weeks, when you get to that part of your pregnancy, it's actually advised that you start gentle, deep hip openers to help with the relaxation of the pelvic floor and the opening of the hips to help during the birth. But before then, I would advise that your range of motion be decreased, especially in the squat movement pattern. So just remember the 70% rule. Now, you'd think this one would be a no-brainer, but I seem to be saying that a lot in this video. And I just have to say this particular one because I've actually been shown an online pregnancy program that's been programmed for a pregnant woman to do lying hamstring curls. But just so we're clear here, lying on your stomach should be avoided during pregnancy. In fact, any exercise that has you placing pressure on your stomach or your bump, right, as it grows, needs to be avoided. And we're going to talk hip thrusts now because, I love a hip thrust. They're a fantastic exercise for pregnancy in most of their variations, except when you're placing a barbell over your lower abdominals. Again, you'd think this is a no-brainer, but ladies, just so we're clear, you do not want to be placing a barbell, loaded or not, across your hips during pregnancy. And we're going to talk jumping now, and this includes things like box jumps, broad jumps, vertical jumps, depth drops, bounds, hops, and you know what? I'm going to include skipping in here because this is essentially a series of tiny hops or jumps. Now, the reason for all this is because it places excess pressure on your pelvic floor. It can also cause falls, injury, and actually it's really difficult to maintain neutral intra-abdominal pressure throughout any of those movements, right? Now, I love an isometric exercise during pregnancy. So an isometric exercise, if you don't know what they are, is a static hold. And of course, you can do this variation in many exercises. But the key to these is, again, being able to maintain neutral intra-abdominal pressure. So any hold that's causing your abdominals to bulge or push or peak outwards, right, should be regressed back to a different exercise. And if the regression still isn't working, then it's maybe time to choose another exercise variation where you can maintain it. And when we're talking maintaining neutral intra-abdominal pressure, I'm going to place your vertical pulling exercises in here. Now, these would be things like chin-ups, pull-ups, and even some lat pull-down variations, right? And typically I avoid chin-ups and pull-up variations during pregnancy, basically because maintaining neutral intra-abdominal pressure and stopping the abdominal pressure pushing out through the abdominal wall or down through the pelvic floor. Obviously, I can't see that, but it's pretty real that it's going to be happening because it's difficult to maintain this. And I've even seen very, very experienced CrossFit athletes who have great control of their bodies unable to do this. So the likelihood us mere mortals can do it is, pretty damn slim. Now, the lat pull down is a fantastic exercise and one that I include in many different variations for my pregnant clients. However, ensuring that they're breathing correctly and not hyperextending through their spine is crucial. And I have a specific trick that I use, but as much as I want to share it here, there are some things that I'm just going to keep for my clients. So you know what? If you want that trick, you know where I am. Now, I've already touched on the rower and the athlete example, but again, I typically avoid putting women on the rower during pregnancy. And I also don't like half and quarter reps known as partial reps, right? On lower body push exercise variations like lunges and squats during pregnancy. Now, the reason for this is the excessive pressure that it puts on the pelvic floor. And the other reason is these particular exercises are typically only programmed after completing a full range rep, which requires a full range of motion. And realistically, training methodologies using partial reps like 1 1/4, 1.5 reps are more advanced methodologies that are typically reserved for intermediate to advanced trainees, and they help to reinforce kind of technical proficiency and improve sticking points. And they shouldn't just be thrown in there for the sake of it, right? And that's not what we're looking to do. Now, so basically, any movements where you can't maintain neutral intra-abdominal pressure, causing your abdominals to bulge or peak outwards, need to be modified and regressed. And this can actually be anything from push-ups to planks to side planks to being in a quadrupled position or your hands and knees, lat pull-downs, chin-ups, and any loaded exercises that are too heavy for you. And it's really important during pregnancy to be as hands-on as possible. And by this, I mean whenever you can, you should be checking in with what your abdominals are doing by placing your hands on your bump, right? Now, other things that I typically avoid are things like barbell overhead press, double overhead pressing, or exercises that place weight vertically overhead using both arms. Things like a squat with a double overhead press, right? Or a squat press. Now, the reason for this is that your spine is just unstable due to your weakened abdominals, right? And vertical overhead pressing can place excess pressure on the spine or create excess curvature of the spine. And another reason for this has got to do with blood flow and blood pressure. Again, this is a brief overview, and I talk about all of this, blood pressure included, at excess curvature of the spine, all that stuff in great length in the pregnancy process program. So we're going to move on to equipment now. So when it comes to equipment, unstable surfaces such as the BOSU, wobble boards are out, right? Not only because of the fall factor, but the reality is pregnancy changes a woman's center of gravity, and the hormone relaxin creates more elasticity in ligaments and tendons, making joints more unstable. These factors alone challenge balance and joint stability enough without adding an instability factor of a BOSU or a wobble board. Again, you would think that this is a no-brainer, but I can't even count on both my hands the amount of times that I've seen pregnant women being put on a BOSU ball by other coaches in commercial gyms. Coaches that are meant to be pregnancy specialists, of course. Now, anything that compresses the abdominal cavity due to the position you're placed in to do the exercise, for example, things like, a standing hamstring curl where you're bent over the machine with pressure placed on your abdominals, or even things like the chest supported seated row, that can even fall into this category. Again, I've seen coaches who are pregnant doing that exact exercise. And I also think you need to be careful using the 45-degree back extension and glute ham developer, right? Now, this is due to the position that you need to be in when you're using them and where they're placing pressure on your lower abdominals. And the other thing is that some pregnant women just really don't like being in an inverted position, you know, the position where your head is below your heart, like your head is below your heart and your hips, right? Personally, I love using these machines for isometrics, of course, right? Now, that, of course, is depending on your ability to maintain your neutral intra-abdominal pressure. So those machines aren't out. You've just got to be careful in what you do on them. Now, adductor and abductor machines, also known as the good girl, bad girl machine. Again, as I mentioned, I don't typically use this because of the pressure that's placed on the pelvic girdle by doing that particular exercise. Now, the 45-degree leg press, you know, the one where the weight is coming down towards you, this is a big one for me because I see pregnant women being put on this machine all of the time. And it's important to remember that your spine isn't stable, right? So your spine is in a weakened position due to your weakened abdominals, right? And the 45-degree leg press, where the weight or load is coming down onto you, places excess pressure on the spine or excess curvature of the spine, causing the abdominal cavity to collapse, right? Now, the direction of the weight also places excess load on the pelvic floor and can cause the abdominal cavity to collapse. So for these reasons, I typically don't program this exercise during pregnancy, right? And I'd also be pretty wary of using the hack squat as well, especially because a lot of the time when I see pregnant women on the hack squat, what they're doing is performing a full range of motion squat. And I know that I've mentioned chin-ups and pull-ups already, right? So for pregnancy, I'd also typically avoid the assisted chin-up machine for exactly the same reason. And again, I know I've mentioned this, that any equipment that requires you to lie on your stomach or flat on your back to perform the exercise should also be avoided. And if it was me, I'd swap running on the treadmill for something like the cross trainer or the arc trainer, right? Again, this low impact version is a far better option to protect your pelvic floor and your joints, right, from the impact of running. I'd also swap the stepper or the stair climber or the stair master or whatever it is that you're using for the cross trainer or the arc trainer, as again, it just provides more pelvic support than, you know, the stair master. And I typically avoid leg extensions and direct calf work, or direct quad work and direct calf work. And this is pretty much based on the postural changes that are happening in the body, placing excess load on those muscles already. So why put extra load on muscles that are by directly training them when there's already extra load on them in the first place? Well, that's my thought process anyway, if you followed that train of thought. Now, this list is certainly not exclusive to all of the considerations that come with training the pregnant and postnatal population. However, I think it's relatively safe to say that unless you're being programmed by a specialist, your current programs currently probably aren't taking much of this into consideration, right? And I think it's also safe to say that you don't actually have to look very far to find some, if not many of these exercises on your social media influencers' pregnancy workout video. And after working in a commercial gym for almost 12 years now, I don't work in a commercial gym anymore, but I worked in a commercial gym for almost 12 years, and I've seen pregnant women pretty much doing all of the things that I've just mentioned. Unfortunately, sadly for these women, a lot of the time they're actually with, you know, inexperienced coaches that are guiding them, so they think that they're safe. And the reality is, exercise during pregnancy is a minefield, a place where so many women find themselves in a void of the unknown. You know, they're in that void between the known and the unknown, which is why so many turn to generic free online workouts. And while I will always say doing something is always better than doing nothing, I genuinely believe that there is a better way, a way that includes bespoke, principle-based program design with individualized exercise prescription that's correctly timed, correctly sequenced, and adjusts over time as your pregnancy progresses. Now, if you have any questions whatsoever about the things that I've just spoken about in this video, I know it's been long and I know it's been kind of a bit all over the place, but you're always welcome to join the conversation in my complimentary but private community. The application link is in my bio or the video description. So that's it from me today. I hope this video helped you in your pregnancy exercise journey, and I will see you in the next one. See you.